Hello and welcome. Today we're diving deep into postherpetic neuralgia, or PHN, a chronic nerve pain condition that can linger long after a shingles outbreak has cleared. We'll explore what causes it, how it affects the body, and what options are available for managing this often debilitating condition. So, what causes PHN? It all starts with the varicella zoster virus, the same virus that causes chickenpox. After you recover from chickenpox, the virus remains dormant in your nerve cells. Years later, it can reactivate and cause shingles, a painful rash with blisters. Postherpetic neuralgia is a complication that can occur after a shingles outbreak. It happens when the nerve fibers become damaged during the shingles infection, leading to persistent pain even after the skin rash has healed. Now let's talk about the pathophysiology, or how PHN works in the body. The shingles virus damages the sensory nerves, specifically the dorsal root ganglia, where these nerves reside. This damage disrupts the normal signaling process. The damaged nerves may fire spontaneously, sending pain signals to the brain even in the absence of any actual stimulus. Additionally, the damaged nerves may become more sensitive to even the slightest touch, leading to allodynia, or pain from a stimulus that wouldn't normally cause pain. This nerve damage and aberrant signaling pathways are the underlying reasons for the chronic pain experienced in PHN. PHN is a fairly common complication of shingles. The risk of developing it increases with age. People over 60 who get shingles are significantly more likely to develop PHN than younger individuals. Other factors that increase the risk include the severity of the shingles rash and pain experienced during the acute shingles phase. Because shingles incidence increases with age and vaccination rates aren't universal, PHN remains a significant public health concern. The hallmark symptom of PHN is persistent pain in the area where the shingles rash occurred. This pain can be described in a variety of ways: burning, stabbing, itching, or throbbing. It can be constant or intermittent. Even mild stimuli, such as clothing brushing against the skin, can trigger intense pain. Other symptoms can include itching, numbness, and sensitivity to temperature changes. The pain can interfere with sleep, work, and daily activities, significantly impacting quality of life. Diagnosing PHN is typically based on a patient's medical history, particularly a recent shingles outbreak, and a physical examination. The key diagnostic criterion is persistent pain in the area affected by shingles that lasts for at least 3 months after the shingles rash has healed. There are no specific blood tests or imaging studies to diagnose PHN, but these may be used to rule out other conditions causing similar symptoms. While there aren't distinct types of PHN, the presentation and severity of the condition can vary considerably from person to person. Some individuals experience relatively mild, manageable pain, while others suffer from excruciating, debilitating pain that significantly impairs their daily functioning. The location of the affected nerves also influences the specific symptoms experienced. Unfortunately, there is no cure for PHN, but there are several treatment options aimed at managing the pain and improving quality of life. These include topical treatments like capsaicin cream or lidocaine patches, which can provide localized pain relief, anticonvulsant medications like gabapentin or pregabalin, which help stabilize nerve activity and reduce pain signals, antidepressant medications, specifically tricyclic antidepressants, which can also modulate pain pathways. Opioid pain medications may be used in some cases, but they are generally avoided due to the risk of dependence and other side effects. Other options include nerve blocks, injections of corticosteroids or local anesthetics, and in some cases, even surgical interventions. A multidisciplinary approach involving pain specialists, neurologists, and other healthcare professionals is often necessary to develop an individualized treatment plan. The best way to prevent PHN is to prevent shingles in the first place. The shingles vaccine, called Shingrix, is highly effective in preventing shingles and, consequently, PHN. It is recommended for adults age 50 and older, regardless of whether they've had shingles or chickenpox before. Vaccination significantly reduces the risk of developing both shingles and PHN. The prognosis for PHN varies. For some, the pain gradually improves over time, even without treatment. However, for others, the pain can persist for months, years, or even a lifetime. Recent research focuses on identifying risk factors for developing chronic pain after shingles, as well as exploring new treatment targets. Researchers are investigating novel drug therapies that specifically target the damaged nerves and reduce pain signaling. Additionally, studies are exploring the potential of non-pharmacological approaches, such as neuromodulation techniques like spinal cord stimulation, to alleviate chronic pain associated with PHN. While there's still much to learn, ongoing research offers hope for improved management and outcomes for individuals living with PHN.